Okay, I'd like to welcome. Hi, I'm Dr. Michael Lutz, and I'm the president of MIU Men's Health Foundation. And I'm really glad you could join us today on Blue Monday, Blue Monday Men's Health Global Town Hall. We're very fortunate to have some very special guests today, but I'd like to start off by announcing that this is International Men's Health Month. June has been International Men's Health Month since 1994 and is celebrated across the world. And today we're very fortunate to have leaders in men's health from other parts of the world joining us to celebrate Blue Monday Men's Health and to be our international collaborative men's health experts. So the way this event is going to go is we're going to actually introduce all of our panelists, because I think that that is very worthwhile, so you kind of know who you're listening to. And then in a little bit, what we'll do is we'll go ahead and do some questions and answers. And if you have questions that you'd like to join us, you can feel free online to send them to us. And they will be forwarded to me, and I will include those as part of our panel discussion today. The first panelist I'd like to introduce is Dr. Dennis Barber. Dennis Barber is the president and CEO.
So basically, I just, as soon as they're done.
Yes. Dennis Barber is president and CEO of the Boys Initiative and the Partnership for Male Youth, and he's out of Washington, D.C. Michael Rovito, Dr. Michael Rovito is an associate professor of health sciences at the University of Central Florida, and he's the founder of the Male Wellness Collective out of Orlando, Florida. Dr. David Kuhl, MD and PhD, is a professor of departments of family practice and urologic sciences at the University of British Columbia at Vancouver, British Columbia, Canada. And Dr. Mara Heeman is a physician and assistant professor of urology at the University of Washington School of Medicine in Seattle, Washington. Dr. Martin Miner is a physician and past president of the American Society for Men's Health and the co-director of the Men's Health Center at the Miriam Hospital and Brown University in Providence, Rhode Island. Dr. John O'Liff is a professor and Canada Research Chair in the Men's Health Promotion at the University of British Columbia School of Nursing, Vancouver, British Columbia, Canada. T.C. Carling is the president and CEO of the Canadian Men's Health Foundation, North Vancouver, British Columbia, Canada. And lastly, Dr. Jesse Mills is a physician and director of Men's Health Clinic at UCLA, Santa Monica, California. And that's it for our panel. And now it's time to actually, let's get this started. So my first question is to Dr. Dennis Barber. Dennis and I have worked together quite a bit, and we've talked a little bit about his focus. And since we know that your focus is on youth, particularly in the LGBTQ youth, how do you think COVID has impacted these individuals? And what needs to be done to kind of level the playing field for all of the youth after COVID?
Well, the data indicate that young men and young women are suffering mental health issues as a result of COVID, and that's going to leave us with quite a legacy, particularly in terms of LGBTQ youth. I might also add LGBTQ youth that are homeless. So we're going to have our task ahead in kind of unspooling this as time goes on, but particularly adolescents have been hard hit by COVID.
Thank you. Thank you very much. Michael Rovito, I have a question for you. With your passion as a testicular cancer researcher and men's health advocate, and the fact that over 25 million screenings did not occur in the United States last year due to COVID, what do you think are the best first steps forward to improve men's health after COVID?
Regarding testicular cancer or just in general?
Just in general.
I guess re-engaging with oneself. I mean, I don't know of any other precedent besides what, it kind of matches up with. I mean, I think people just been in isolation so long and like disconnected it. I think probably the best thing to probably do is to do like a self-check to see where we're all at mentally, physically, spiritually, emotionally, socially, that kind of stuff. So I would imagine just kind of getting what we're starting to get out now in our nonprofit is we're re-engaging with our community, and we're kind of telling men and boys to kind of like do one of these self-care checks and see where we're all at, how we're feeling mentally and stuff like that, and then go out and do that. So that's what we're doing right now in the field.
So how do you get people, just as a follow-up, how do you get people to not be as fearful? I think one of the things that a lot of people have nowadays is, this fear of being integrated back into the communities. They've been isolated for so long. They now have this fear of being around people, almost becoming agoraphobic. So how do you try and do that?
It's a real thing. I mean, we're going back to teach face-to-face come the fall. We got our invite to do a face-to-face faculty meeting, and even we're kind of like how's that going to work? So it's a real thing. I mean, to acknowledge that fear as being real is probably a very important step. We shouldn't brush that aside. I don't know. I don't know what the answers are. Just we got to take baby steps and see how just kind of gauge with litmus test people's comfort level, and then just act accordingly. I mean, eventually it'll start drifting away a little bit, but at first we have to kind of like take baby steps to see where everyone's at, and then approach it appropriately for everyone else's comfort level. But I don't know. That's a really great question.
That's great. Well, thank you. And as far as testicular cancer screening, I do want to touch on this just for a brief moment. As you know, and I know, it got a D rating from the U.S. Preventative Services Task Force. Whenever I have this conversation with anybody, they just are totally confused. And I cannot tell you how many times I see young men who come in the office for testicular masses. And although the majority of them are benign, I diagnose at least one testicular cancer a month in my practice. So it's there, it's real, and it's affecting young men.
Mm-hmm.
How do you think that we can move forward to make the U.S. Preventative Services Task Force, just in general, a more responsive organization to community needs rather than as a organization just trying to watch out for the bottom line?
If you could find the answer to that question. Well, it does come down to the bottom line. It comes down to numbers as well. We have evidence to suggest that it is beneficial. We just did a study and we just showed some evidence that regular TSC before diagnosis was linked with an earlier stage diagnosis. So if you did it regularly before, now it's just correlational data, correlational findings, but still, it's still something. We did find that if they did do it earlier, before diagnosis, they're going to get it earlier, or if they had testicular cancer, it'd be an earlier stage. So we have that full pot of evidence, and we published that, and that went over like a lead balloon. It's just like we have the evidence. We kind of argued that, cost benefit analysis, if you do get this stuff early, and we all know there's like less and less invasive treatment, decreasing costs. It's like we have all the pieces of the puzzle and we're putting it together, yet it doesn't resonate. So I'm still trying to figure that one out too. I'm going 0 for 2 here with your questions, but I can't figure this stuff out. It's like my lifelong kind of quest to get the task force to pay attention, but I don't know. Just to get a seat at the table and just to have their ear would be a victory for us. And if I could figure that out, that'd be something great, but I don't know.
Well, I will work on getting you that seated.
I hope so, because I want that conversation. I appreciate
that. We'll do that.
Thank you.
Next is a question to Dr. David Kuhl. David, with your expertise in end-of-life care and an understanding of the essence of iatrogenic suffering, which I took as a quote from one of your bios, what do you believe will be the short-term and long-term impact of the COVID pandemic on men's health?
I think that in terms of men's health, they've spent time on their own. In terms of something we've looked at specifically, it has to do with the relationship with their children. And that we know that men who are in good relationship with their children will have better and improved health. And we learned that from focus groups that we ran, that they reflected on their previous relationships with their kids and realized that through COVID, they spent more time with their kids. They spent time with their kids differently. And we also know that there's a difference in terms of how they spend time with the sons and with daughters. And we're beginning to understand and appreciate that some of them reflected on their relationship, and they really wanted to change how they spent time with them. And many of them talked about how hectic their lives were with regard to their kids' activities, and decided that they would never want to go back to that after COVID was over. So I think that the challenge for their sense of satisfaction as being actively involved in their kids' lives, understanding how their kids learned and how they could support them in their learning, how they could have quiet Friday evening dinners rather than the catching food on the run because they were going to one more hockey game, one more football practice or dance class. So I think that what we know in terms of the experience they've had is there a lot of men will be reflecting on how they spend time, and that their mental health actually is also linked to their relationship with their children and their families. And I think it'll be a big challenge for some of them, where the expectation is that they return to work the way they were working prior to COVID, and back to spending long hours on commutes of going to work and coming from work. And that I hope and trust that through this they'll self-reflect and ask some tough questions about their own sense of well-being and purpose with regard to the experience they've had. Bit of an indirect response to your question in terms of the whole iatrogenic suffering really pertains also to the way doctors treat patients, causes them more harm than they experience from the disease itself. And I don't know about how that links to COVID, but I do know that fathers also have explored how they can be in a healthier relationship with their kids, which then also affects their sense of well-being.
Well, actually, your comment about physicians treating patients differently, we're dealing with a racial disparities crisis that has really surfaced really intensely as a result of the COVID pandemic. And we have now really shown evidence that patients of color were treated and viewed differently when they came to the ER with COVID symptoms, and were brushed off more regularly than addressed it appropriately. And so your comments are so apropos.
Right. So the definition of the iatrogenic suffering would be the way the doctor talked to me caused me more pain than the pain from the disease itself. And we've learned some of those same features in Canada with regard to our attitudes, especially to the Indigenous population. So we have a lot to learn and a lot to change and improve in terms of how we respond to the needs that men and women present to in terms of healthcare.
So just as kind of a follow-up, you kind of broached on an issue of that generational discussion between fathers and sons. And we have always used this International Men's Health Week leading up to Father's Day as a way to initiate that conversation between fathers and sons. Do you have any ideas or concepts as to what's the best way to try and set that conversation, and what should be some conversational goals that fathers and sons really should try and achieve during Men's Health Week?
Interestingly, one of the things that I quote comes from Obama, who was asked about his relationship with his daughters. And he said, in terms of having quality time, you need to have quantity of time. And so that's one of the things that for me would be the starting point. And that really the opportunity to be with your kids and to be with your adolescent kids, get them in a car and drive somewhere because they won't get out. You don't have to face each other, especially with fathers and sons. Sometimes it's hard to have challenging or intimate conversations when you're looking at each other. It's easier when you're both looking in the same direction. And so that be available and be curious. Be curious in terms of what your kids are asking you, and make sure that you understand the question, because they don't ask questions without purpose, but they may be intending a different question than what you understand it to be. So it's really important that I take off my own lens about what they're asking and try to look at the question they're asking through their lens. What is it they're really asking me? And also to be open and curious as to what their interests are. How do they really want to spend their time? Am I putting my expectations of behavior and activity on my kid, or am I really able to explore with my child how they want to spend time, who they want to be? And we might be in for some surprises. Some might be challenging, some might be exciting, and just to be always open and compassionate to your kids, because they may have opinions that differ from mine as a father.
Thank you. Thank you so much. Next is going to be a question to Dr. Mara Heeman. Mara, your expertise is in male sexual health and cancer survivorship. So cancer survivorship, as we know, not only affects the individual affected with the cancer, but all of the family members and in different ways. How has COVID changed your perspectives, and what services do you think we need to provide to improve the outcomes for patients and their families?
Yeah, I think COVID has shed some light onto some really beneficial technologies that we have that can be utilized not only in male sexual health and male infertility, but in cancer survivorship as well. And really that is telehealth. So telemedicine has been a really amazing adjunct to my practice and has allowed me to sort of see men where they are most comfortable at home. And I do think that having the ability to speak with families in the comfort of their own homes is critical to cancer survivorship discussions. You know, you see people kind of together at their calmest and probably most receptive to education and information. And that's been a really great part about my practice for the past year. And I do hope that that continues going forward.
So, you know, as a result of telehealth, we've actually used the Zoom meetings for all of our prostate cancer survivorship meetings, which we now hold quarterly. And we have found that that's a really great way to engage men who maybe are shy or reticent to leave their homes. But the one thing it misses is that camaraderie, that sense of belonging to each other and supporting each other, which is one of the essences of the support group. So do you have any ideas as to moving forward, like men's sheds are popular in Australia or in the UK? Do you think that we'll ever be able to develop some type of support technology or services that'll be more advanced that will actually achieve that camaraderie that is so necessary?
Yeah, I think you bring up a good point. That is, you know, I think there's pros and cons to using telemedicine and of course using Zoom. And there's something about that personal connection and personal touch that's lost when we're across a screen. You know, in terms of, I'm unaware of the technologies you brought up and the groups, but I'm hopeful that we can return to kind of a mix of using these technological formats, but also seeing each other in person, because, you know, we are tribal organisms, and I think being in spaces together is important when we're healing or when we're learning. And while I think it's helpful for me to have the resources to be able to meet men in their own home and their families, there's something different about when they come in as well. And, you know, having the ability to smile with someone and or comfort them. I think both are important. So hopefully we can move into a place where things are safe to be back together. And I think we're getting there here in the US. But also can use these formats for more, you know, regular touch points as well.
So just kind of as a brief follow-up and something that's in your area of expertise, which is male sexual health, COVID has had some impact on male sexuality. Have you seen a rise in male sexual dysfunction? And do you also believe that COVID infections have actually had an effect on erectile function in men as a result of the actual infection process?
Yeah, I do think we know that COVID has changed a lot about sexuality in terms of dating and people being obviously meeting each other. I do think that obviously we know the mental health impacts of COVID have probably impacted sexual function, although that hasn't, you know, there hasn't been any distinct research outcomes on that at this point. I know from my practice here in Seattle that just basic stress of being in high pressure jobs, working for Amazon, working for, a lot of these tech companies, it does impact young men's sexual health. And so I would have to think that COVID probably similarly impacts young men. There is some literature coming out of the University of Miami demonstrating the COVID virus in penile tissue. And, we know that this is kind of an inflammatory virus. And so whether there will be long-term impacts on the endothelium of the penis and, a true organic ED, I think we need a little more time to see.
Thank you. Thank you very much for answering. Next is a question, Dr. Martin Miner. Marty, you have the unique expertise of running a full-service men's health clinic in addition to one of our other panelists. What do you believe is the most valuable service a men's health clinic provides, and why is it not translated across the USA?
Well, that's also a very interesting question, Michael. You're full of great questions today.
You're smart, yeah.
No, I'm serious. What we provide is a multidisciplinary team to see men. Often the mean age of the men that I see is in their mid to late 40s or early 50s, who have multiple comorbidities. But the most common two comorbidities, I would say, would be hypertension and obesity. So they have basically the beginnings of metabolic syndrome. And with that, they have erectile dysfunction and or disorders of desire. And what we've found is that these disorders are still not addressed in the primary care space. They're still given a very brief acknowledgement and a backdoor form of recognition, which is not legitimate. And so these men don't have their levels measured, their testosterone levels measured, they don't know their fasting blood sugars, they don't know their lipids. And our purpose is to educate them into their information as well as their diagnoses and help them, but not only help them medically, but help them with lifestyle. And that could be, as Dr. Rivado mentioned, spiritual and psychological and behavioral aspects of their lives. COVID has certainly stressed that, and you've seen that in every realm. Men have gained more weight. They've become more sedentary. They have had limited opportunity to go to the gym to exercise. And their sexual function and sexual desires have, in general, plummeted. And I don't know why men don't have this space to talk about themselves as sexual beings, that somehow, and even post oncology or survivorship, there rarely is their sexual function addressed. And I think it's vital. And there are, since 2008, when we opened, or 2006, there have been several men's health centers that have opened in Seattle, in LA, but it's still more of an exception rather than the norm. And I think it needs to be more norm.
So do you think it's more a monetary issue as to why the men's health clinics have not actually prospered or succeeded? Or do you think it's more of a societal cultural issue with men in general?
I think it's both. I think in order for it to succeed, there have to be some monetary, you have to be able to support yourself. even at an academic center, as you well know. And I think it's when you're not doing a lot of procedures in men's health, you might treat Peyronie's, you might do a couple other procedures that may be expanded in the urological realm in andrology. But you need those procedures to almost support the centers. And then men are still hesitant, and they often don't come to us. They're still at our university. Women's health and the Women's Collaborative is very well established and well known and well advertised, yet men's health remains the small enclave in our domain. And it really hasn't expanded, just like trans health hasn't really gained a foothold, but it's just beginning to at most universities.
You know, you started a brief conversation about men versus women and how they seek out healthcare. And a great example that we've seen here in Detroit is when they do Breast Cancer Survivorship Day at Tiger Stadium, well, actually Comerica Park now, I'm dating myself. Thousands of women will jump out onto the field yelling and screaming and throwing up their shirts and just, you know, waving them in the air and just surviving and supporting each other. Whereas prostate cancer survivorship at Comerica Park, you're lucky if you can get 100 guys together.
Right.
It's,
and you know, and there really are not rehab programs to help men post surgery or survivorship programs post prostate cancer, and it truly does it has an incredible impact on one's sexual survivorship. And what about androgen deprivation treatments and so forth? It's we're still, I think women have always been much more able to vocalize their needs. And in fact, many of the men that I see are here because of their partners and their desire to please their partners, and here because the appointments were made by their partners. But I think we need to expand that and galvanize that.
and thank you, and thank for the work that you do. And we'll probably talk a little bit more about this on the other half of the hour. Dr. Olive, all the way from Vancouver. It looks like you're right here though. You've been a long-term men's health researcher, and you've published hundreds of relevant peer-reviewed articles. How do you believe you can best educate, engage, and impact the healthcare and the lay community regarding the issues of men's mental and physical health and well-being following COVID?
So, yeah, I think it is interesting. I think the mechanisms, you know, for educating people around the challenges for men in a post-COVID world would be to dispense with some of the misinformation that occurs in the press. You know, we often tell the story of guys not going to the doctor, not seeing a physician, and that might be true for the 20 through 45 kind of age group, but you know, the numbers even up in the back end of that, you know, 50 onwards, you know, the numbers that they tidy up. So sometimes by telling a story that's about strength, about what guys do, that can actually norm the idea that fellas would go and see a physician. So in the case of in the context of COVID, I think there's a couple of things. One, I don't think there's ever been a period in history where there's been so much time for retrospection, so worrying about things past, and so much anxiety about things that are about to happen because you don't know what they are. So anxiety and depression kind of colliding, and just a lack of things happening live. And guys often live very public lives, and that's been taken away to some extent. And then in the aftermath of COVID, I think we're staring down a financial crisis. No matter what way you look at it, you can't print money forever and not have to pay it back at some point. And there's changes to jobs. There's changes about how we do our jobs. There's losses. And I think, you know, those things combined, I think those stories need to be told in a way to expect these transitions to be very challenging for guys coming forward. And we need to get ahead of the curve. One of the things we're doing here in Canada is that we're waiting for the epidemiology of the problem of mental health, ACCA suicide rates, and it's, to be frank, it's too late. I mean, you don't need the data to know that men are suiciding at 3 times the rate of women. And it's not to set up a competing victim discourse, but it is to say this isn't going to get better post-COVID. Like those numbers will prevail. So we need to really think about some tailored and targeted services for guys.
Yeah, people oftentimes think it's a binary discussion of men versus women, but it's not even close to that. That's not the discussion. The discussion is that if we can improve the health of the men in all of our communities, it's going to help women and the families. Everybody wins. It's the rising tide phenomenon. And we need to get that message out there, because every time we have the discussion with organizations about supporting men's health, they always come back to me and say, well, what about women? And I'll say it's not a negative towards women. We're trying to help men, to help women, to be a more active partner, active participant in moving communities and societies forward. So do you think that there's something that can be done to try and be that carrot versus the stick to get men more engaged and involved, to move things forward as we're looking ahead into 2021 and 22?
Yeah, we've always believed, and I really appreciate your point, Michael, too, around the relational piece of gender and men's health. And I think we have to continue to restate it. One of the ways in is we pay very good attention these days, increasing awareness around diversity within the category of men, be it race, be it sexual identity. So we neglect that if we set it up as a binary and we just kind of put it as a competing piece. So I'm so glad that you mentioned the relational piece, really important. In terms of, guys buying into health and well-being, asset building, strength-based, talking to what guys can do legitimately within their means, I think is one of the most important pieces we can do. And I really like Michael's point about baby steps. Sometimes, it's just about graduating to things to make them habits and good habits, and just putting in those small gains and personal bests, not the competing piece around such and such, got such and such outcome. It's like, no, it's really about, how did I go today? Am I still, tracking a run 3 days a week? Am I still able to sort of get there and back and the warm down? Like just those constant kind of personal bests and buying guys into, those kind of building those habits for feeling good, for feeling, being the best they can be. And whether that's for other people or just for themselves, fine, whatever the motivator is, but just kind of getting them to buy in to the idea that what they do does matter, and it can build assets. Like it's a strength-based enterprise, this piece.
Thank you very much. Thanks, John. And T.C. Carling from the Canadian Men's Health Foundation, talking about leading up to a discussion that's perfect for you. Thanks, John, for the segue. Men's Health Month is celebrated globally, and the Canadian Men's Health Foundation is focusing on Move for Your Mental Health. So why did you choose this focus now, and how can all of us partner together moving forward to enhance this community reach?
Yeah, thank you, Dr. Lutz, and to this entire group for allowing me to be part of the conversation. I think mental health promotion in Canada, at least, has been fairly public-facing, consumer-facing, if you will, for about a decade or so. There's been a couple of large national communication tools. One of the big telecoms, Bell, has one called Let's Talk, of course, Movember, and other organizations have tried something. I used to work in the National Hockey League for 18 years. We launched a provincial and a national mental health campaign 10 years ago after losing a player from his depression. And so I think the conversation has been ongoing and building. And I had an analogy before that once the genie was out of the bottle, it wasn't going to go back in. And I feel like people in Canada, at least, have been ready to have this conversation more readily. But the real motivator for from expanding from Canadian Men's Health Week, which is what it's been for the last 7 years for our foundation, to a month-long speaker and fitness event series was the pandemic. And I'll preface that by saying this is sort of the Canadian Men's Health Foundation's launching pad for continual mental health programming moving forward. However, we really planted our flag for this month around mild to moderate stress, anxiety, and loneliness, because many of us have experienced that in our lives. But for those who hadn't, we've probably experienced some of it in the last 15 months. And I think the pandemic has been the great equalizer for mental health. It's either amplified people's mental health who's been challenged, or it's exposed some mental health challenges to people that may not have ever experienced it before. Because at the end of the day, I think with anxiety, you know, the root, what you're searching for is some type of certainty. And in the case of the pandemic, there's been nothing but a lack of certainty. You know, in our particular province or our country, you know, whether or not your schools would be open, your business would be open, you were working from home. There's been tight restrictions around socialization, seeing people, seeing family, and so forth. So, you know, I rejoined the organization February 1st in this role, and it was about 4 or 5 months before the upcoming campaign. It just seemed like the natural time to really amplify that conversation. And so we wanted to do that in a couple of ways. One, we wanted to give men a tool, men and their families a tool. So we from the Don't Change Much campaign about better sleeping, better eating, better exercise, and so forth, we wanted to give men a tool that's proven to work in the areas of mild to moderate mental health challenges. So we wanted to give them movement as a tool. And so we've populated this month-long campaign around Move for Your Mental Health. And to build off what yourself and Michael were speaking about earlier, it's about small changes though. And so we've partnered with a number of very well-known Canadians, broadcasters and psychologists from Anxiety Canada. And I'm really proud of the 4 speaker series that's available on YouTube. And I would encourage everybody to see them. They premiere every Wednesday and then live on demand. And we've had 2 so far. We have 2 to go. And the one this week is really excellent. It's around parenting with anxiety, or parenting with your own anxiety, or in some people's case, both. And we've got a couple of leading mental health advocates here in Canada that champion that, the famous NHL goalie, Kelly Rudy, and his extremely brave 28-year-old daughter who had debilitating anxiety when she was about 12 or 13, and has had it for the last 14 or 15 years. They walk you through their family's journey in trying to talk about that. And so in this case, you have a very well-known Canadian father with his mental health advocate daughter, and a well-known broadcaster having a 45-minute conversation with a psychologist from the BC Children's Hospital. And yeah, it's been an impactful month so far.
Well, I look forward to sharing this with our audience and also with people who follow our foundation. So we will definitely connect after this event to make sure that we can actually help spread the message that you are doing so well through Canada. So thank you very much. And our last question before we move to the other half of the segment is to Dr. Jesse Mills. Jesse, you're not only direct a men's health clinic at the UCLA, but as well, you just recently published a book called A Field Guide to Men's Health. Why did you write this book, and what do you believe is the targeted effect this book should have upon the reader?
Michael, thanks so much. It's great to see everybody again. What a fantastic panel to be a part of. Mars, great to see you at the University of Washington, and congrats on that. That's really, really cool. Nancy, thanks for being behind the scenes and making this whole program fly. And right, yeah, this is, boy, you know, I think I probably started this book when we first met, which is what, 8 years ago at least, or 10. So it's not a overnight something I just put out. And it is because I got into the whole field for a lot of what we've already shared and the other panelists were discussing today, which is that, especially what Marty said, men, we tend to be underrepresented. We tend not to be as proactive about our healthcare. And we tend, for a number of reasons, there's societal ideas that we have to play through pain. So if something hurts, don't go to the doctor. But if some guy's penis is not working, then he will go to the doctor. And I think that's where, as a urologist, I had that immediate access to care that I could provide men. And then when we find that sexual health is cardiovascular health, it allowed me to sort of, work backwards and become what I call a reverse referralist. So, 40% or so of my patients that I see in my practice, and I see 100% men, don't have primary care physicians. And so I thought, well, if a guy, when I saw him, had a book, or if I could put out a little field guide, something they could open up to any page and learn something, whether it's how to improve mental health, whether it's how to improve their nutrition, their fitness, whether, of course, how it's to improve sexual health, then they would have a couple little snippets or things that they could change for that day. And I think that's the key, is that at this current time, there's not sort of an easy layman's book out there to dispel some of the myths around sexual health, to make nutrition somewhat simple and easy to understand, and then let them choose their own adventure. And I think that's the big difference with this book, is that I'm not preaching anything. I'm just giving guys information so they can make informed decisions about their healthcare, and also the importance of screening and the importance. I appreciate what you and Dr. Ravita were talking about earlier with testicular cancer screening, and I have a section in the book that the reason that the testicular self-exam got a D rating was because guys don't know how to examine their testicles. So if we could just do that one thing and teach guys normal anatomy, and that they can tell the difference between an epididymis and a testis mass, then there's going to be a huge role for self-exams. And so I think it's little things like that, that it's, they made it an owner's manual for everything from a guy's penis to his mental health. And it's been great. I'm very excited. So it'll, pre-sales are going to be later this month, and then it'll be everywhere books are sold. December 7th is the release date. So it's a new year, new you kind of book.
In our foundation, we try not to take ourselves too seriously. So we had a testicular cancer screening campaign called Got Nuts, Check 'em. And so we had all these posters created for the back of all these beer trucks that went all throughout the southeastern Michigan. And the one thing that the beer distributor quickly realized is that people actually read these signs. And all it did was get negative comments everywhere. People were yelling and screaming, how can you put that on a billboard? How can you do that? What am I going to tell my son who's sitting in the car with me? And we said, that's the time to have the conversation.
Exactly. Right. In LA, in LA, any publicity is good publicity. So you're doing it right.
Yeah, there you go. And so if you're looking for a great video, we have one embedded on our website. It's Deadpool, talking about testicular self-examination. So if you haven't seen that one, that YouTube video is absolutely worth seeing. So I'm actually going to move on to the other half of our segment, and this could be a question for everyone, and I will actually call upon you one at a time so that we don't talk over each other. We've spoken so far about the multifactorial impacts of health upon adolescent and men, but sometimes guys just need something really simple to focus upon, and it reminds me of my conversation earlier tonight with T.C. Carling and the Canadian Men's Health Foundation, and your previous campaign called Don't Change Much. And I love that campaign. And so I'd like each of you to kind of tell me, what is that one focus, that one health parameter that should be somebody's initial priority to become their healthiest self? And so I'm going to start back with Dennis, who's been able to sit quietly for most of this time. Dennis Barber, tell me what you think is that one focus that you think that should be their initial attempt to change their health. You're on mute, Dennis.
Sorry about that.
Perfect, thank you.
And now, it's really a systemic problem, because as we say, by the time adolescents reach puberty, 80% of them stop seeing a pediatrician. The females typically transition to gynecologic care, but the males don't. They simply drop out of the system, and that's part of the reason why men don't get these messages, because they're not exposed to healthcare, the healthcare concepts, when they're adolescents. And so one of the challenges is to create systems where they interface with the messages of health, and that is truly a challenge, because you could look at venues like schools. But school nurses typically are trained to see females, not males. They generally feel uncomfortable seeing males. Males don't go because there isn't a pressing need for it. So it kind of, I'm responding in a more global context, but I think it's important that we keep that context in mind, because that's where the problem starts, is in adolescence and their attitudes towards their own health and what happens to them as they age. They become older and they become even more distant from the healthcare system.
Okay, thank you. Thank you very much. Michael Ravito, what do you think is that one thing that we should focus on to improve the health and well-being of our male community?
You know, people don't talk about stress a lot and like the latent stress. People are, I think that's a really important thing. It's not just about older men or men with children. As Dennis was saying about, you know, like his focus on adolescents, everyone, there's so much stress out there among these college students that we're teaching. I mean, it's almost palpable how many stressors they feel every day, and it just compounds because there's so much out there now. It just seems like every generation gets more and more complex with everything that's going on with technology and stuff. I'd probably say to de-stress somehow, or at least understand what stress is. Are you stressed, and like what it's kind of doing to you, or what it can do for you? That's one thing I'm trying to preach now is, again, going back to my whole point before, like checking in with yourself. A big thing is this level of stress and the stressor that they're all feeling, because that's not immediate, or there's an immediate response, but then you have like this allostatic load going on for your lifetime. Who knows what that can cause, like when you're 40, 50, 60, whatever. I'd probably say, I'd probably preach that, Ellen, right now.
I say you're pretty spot on. At last year's men's health event that we held here in Detroit, we screened 840 men, did questionnaire data, and what we learned is that there was a significant disparity in daily stress that was so statistically significant that men of African descent had a significantly higher stress level. And the stress level was related to, will they have a job? Will they be able to put food on the table? Will they have health care? Are they going to get sick? Are they going to catch COVID from somebody else? And so that daily stress was incredibly high, and particularly in the men of African descent. So I think you're spot on, and that's one of those things that should be one of those first things that we need to address and find ways that guys can have that reality check, kind of check in with themselves. Are they feeling stressed? Are they not? If there's a way to kind of internally measure that, and I know that some others will probably have some comments on that, particularly TC in a little bit, maybe even David. So David Kuhl, what is your thought? What is that initial thing that you think that we should focus on to get things moving on forward past COVID?
I think what's really important for men is to identify a close friend. We know that men who have close relationships live longer. And it's not just a friend that you talk sports about, that men can be isolated if they have some concerns about what's going on in their lives. So we have another campaign looking at NHL alumni and encourage them to make a call. And we know from studies on resilience that if you can name somebody who has your back, do each of you have a name right now of a person you can name who has your back, who you could talk to about anything, to whom we did a whole study around prostate cancer, working with groups of men, making the unspeakable speakable. So what is your speakable topic, and who is your guy friend that you can talk about it? Because also we learned from that study that most of the men talk primarily to their partners, their spouses, and in that circle they realized they were topics they'd never talked about with anybody. So is really move out of social isolation, move into a close relationship with a male friend, a male colleague with whom you could speak the unspeakable, and work at making the call, pick up a phone, make the connection, and let somebody know that they are the person who you believe has your back, and also perhaps remind them that you also have theirs.
If I remember correctly, a few years ago, there was a campaign called Got Your Six. I don't remember who founded it or who was running it, but in military terms, it means I have your back.
Yeah.
And I love the Got Your Six campaign. And I really think that if you were interested in starting that campaign, I know that we and other organizations would be glad to partner with you into trying to get that message out there, because getting your six for men is really crucial. And I think that guys get that. And I think that that's a great concept. I want to thank you for that contribution.
Yeah, and just one more piece. We've worked with the military, and the group that we worked with, their motto was never alone. And we've also more recently worked with firefighters, and their motto is 2 in, 2 out. You never leave a fire. You go into a fire with somebody else, you come out of that fire with somebody else. I think those are really powerful mottos that we all need to adopt.
Absolutely. And I hope that we talk more about this when we're offline in a future date. So thank you.
I'd like that. Thank you.
Dr. Hemon, you're sitting there quietly, I can see. But what I'd like to do is I'd like to know, what is your thought as a practicing urologist? What do you think is the one thing you'd want to tell men, whether they be young or older, to focus on to get a healthier well-being of themselves?
Yeah, I mean, I think that all of the things that have already been mentioned are of critical importance. You know, I think mindfulness and stress reduction kind of across the ages is incredibly important. So whether that mindfulness comes from practices like meditation, or my favorite form of mindfulness being exercise, and what I recommend to all of my patients, you know, I think that that's of critical importance now. So I think Dr. Rovito, you know, talked about the level of stress in our society right now. And so being able to be present and clear of mind, and then that being helpful with things like communicating, as Dr. Kuhl just mentioned. That's my main tip to patients, is to try to practice mindfulness. It has impacts in sexual wellness, fertility, and of course, just overall general wellness as well.
Thank you so much. And Dr. Marty Miner, what is your perspective on that one thing that men should change to make a difference in their overall health and well-being?
Well, I like all the ones that have been suggested, including movement. The one that hasn't been mentioned is very appropriate, and that's vaccination. HPV-related malignancies are on the rise in young men and women, in older men and women, and we failed to give HPV vaccination to men that are eligible now. And I would imagine, I just had a long conversation this morning with a man who failed to get the shingles vaccine and now is suffering severely over the past year with the sequelae of shingles. So not only COVID vaccine, but HPV vaccine, shingles vaccine, these are vital for us to preach to men and try to eliminate some of the miscommunication and non-fact about these vaccines and the efficacy.
So, you know, every year at our Men's Health event, we take a focus. And 2 years ago, our motto of our campaign was vaccines are not just for children. And so we talked about the role of the HPV vaccine, as well as all of the other vaccines that adults can actually take. And there's this stigma about the HPV vaccine. The stigma is that if they give young girls this vaccine, that they're going to be more sexually promiscuous. It's almost like oral contraceptives round 2. So how do we go about changing the stigma, and how do we get HPV vaccines as one of the mainstays in vaccine therapy for adolescents and young adults?
I think we have to actually show parents what happens in these HPV malignancies. So the only way to not frighten them, but just to stress the importance that we don't have a lot of treatments for these malignancies at this point, but prevention. And the major means of prevention are the vaccines. And I just hope that eventually that stigma will be alleviated in both young men and women. No one likes to think of their young child as being sexually active. I think that's part of it. But the truth is, we're all human. And being human means that we're going to be sexually active at some point.
Thank you. Thank you very much. Dr. Olaf, what is your thought? What is your one thing that you think we should change to actually improve the health and well-being of men, young and alike?
Yeah, maybe one of the blind spots in men's health has been around relationships. I'm talking about intimate partner relationships. You know, divorced blokes are 8 times more likely to suicide than divorced women, for example. There's a lot of stress goes on in relationship, and to the COVID point, we've done some survey work that suggests that a lot of dissatisfaction in relationships. As a result, the pressure on the domestic sphere, you know, everyone being stuck at home and trying to work and childcare from home. So just a shout out that you know, in terms of relationships, there's not a lot we do to teach guys about how to be in a relationship. And often our forefathers aren't necessarily the guys to guide us because things change over time, you know, contemporary issues and partnerships change as they should. And so, you know, I think it's one of the bits we need to pay attention to, how to best equip guys with relationship skills rather than be caught with there's a lot of traction around domestic violence, intimate partner violence, but gee, it'd be great to get upstream and to really be able to help guys build relationship skills. So that'd be one that I'd suggested would be nice to sort of to have a look at.
Well, you kind of touched on something interesting. You talked about divorce and stress and relationships. You know, I remember going back now to 1980 when I was in medical school. There was this scale of stress points that you collect by death of a spouse, death of a child, divorce. And some of those are worth 100 points. If you collected over 200 points in 1 year, you were destined to have a major illness. And I've always stored that in my head because I'm trying to make sure every year I don't collect too many points. And so I totally agree with you that, you know, keeping the idea that, you know, divorce is very important in relationships relating to divorce. It's really important that we look at these perspectives because we don't want to collect too many stress points and develop a major illness. That's obviously what we're here to try and prevent.
Yeah, it's interesting too, Michael. As researchers, we don't do a good job of this either, you know, because we tend to regress those as demographics against, you know, some other outcome. So we don't talk to it in a way in which it gets highlighted enough. And maybe, you know, I'm a fair way from clinical practice these days, but maybe it's also something clinically that we probably perhaps didn't ask about, you know, in the depth that maybe we could have. To think about, you know, what the implications might be for mental health, you know, around those kind of changes outside of, you know, some of the physical things. But yeah, I think it's a blind spot, significant one.
Thank you very much. TC Carlin from the Canadian Men's Health Foundation, what are your thoughts on that single thing that we should look at? And it kind of fits in with your Don't Change Much campaign.
It does, and there's been a number of great points made. So I'll just build off one with a really simple message, I think, is that self-care is not being selfish, and that if you take better care of yourself, you can take better care of your family, and then you can take better care of your community. And so I think that's the simplest thing I would try to get across at this point, because you know, Dr. Rovito talking about stress, and we've got an entire campaign trying to look at stress and anxiety and loneliness. And I heard earlier about exercise, and I agree with all of those things. And I just think that they all ladder up to taking better care of yourself so you can take better care of others. And so,
you know, that reminds me so much of, like I always say, be self-ish, not selfish. And it kind of reminds me of, you know, when you get on an airplane, they talk to you about the oxygen mask come down. You have to put the one on yourself first because you can't help anybody else unless you're okay.
Exactly.
And although that always sounded odd to me, now I get it. And it's taken me a long time to finally get it, but now I truly do. And that's, I believe in your message.
Yeah,
so thank you. Jesse Mills, you're our last one to actually tell us your thought. What do you think is that one thing that we should do?
Eat, move, sleep. That's it. So I think when you break down everything, you can get as complex about it or simple. So for somebody that's just starting their journey towards better self-care, eat a little less than they did the day before, move a little more, and sleep a little bit more. And then you can break into that granularity for wherever it needs to go. But I think if we talk about stress and we talk about relationships, you can frame all of that around just those three pillars of good men's health. And that's what I do. And I think anybody, whether they are morbidly obese and just starting to get into something, or whether they are competing for a fitness championship, that's three areas where, as physicians and healthcare providers in general in the men's health community, can help steer people towards better health and make it as simple or as complicated as the audience will be appreciative of.
Thank you so much. Well, this has been pretty fascinating, and I got caught off guard with some of these vaccinations, relationships. These are, you know, eat, move, sleep is, you know, we talk about it. We talk about obesity, you know, watching your weight. All these things dovetail in, but creating the healthier whole person is really what our goal is. And everybody has had so many wonderful ideas. This has been an extraordinary town hall for me, especially being with a panel of what I consider some of my absolutely favorite people. Some of you I've only met today, even though we've spoken in the past. And I'm totally blown away with your expertise, and I'm looking forward that when this wraps up, that we will reach out to each other and we'll actually try and move the needle on men's health, not only in each of our own communities, but help move the needle in men's health in your communities as well as our own by sharing what we do best and best practices, and maybe changing that one thing that will actually make men better and make them healthier. If you want to see this town hall in the future, and in parts or in its entirety, feel free to visit our website at the MIU-MEN'sHealthFoundation.org. This fall, we'll be holding a men's health event at Ford Field. All of you are all welcome to come join us, and we would love to have you here. Come to Michigan, not to come to watch the Lions at Ford Field. I'm not recommending that. That's probably not healthy. It'll probably give you more stress points, and God knows what major illness you'd get from that. I just want to wish everybody a happy and a healthy Blue Monday. I want to say thank you so much for giving up your time and you're sharing your expertise with all of us today. And I hope everybody learned a little something. I know I got a little bit smarter today and maybe care a little bit more about the people around me. So thank you so much, and thank you for watching My Six. Bye-bye now.